زخبركم حتنان أحواتنان كلهم أم العالم تركبوا أنا لهم معنتي فليز بلا برنامج حزنا مسئنا لنا زيون نتعنا زملكت يخون لمي نيتعنا مهرتي nurse practitioner قالين حفتين زخونت حزة مسئلهو نسا vaccination نزملكت مساي كوينا نتهزبنا awareness كلو هم محارلو زبل مدام حزنا لنا تخططولنا كل جزء بتقرنيا أيو نتحلل فوزنا برنا حججن دكنا عبزيز تولدو دكنا توليدهم بناشتهم زموسو بزحنا يتقانقوا شجر كل سلازخل بإنجليزية قالي دانايت صبوا غير خطو برهاية أنا خاني بتقرنيا بزخ الكوو كترجم خفتنيه تناي ميديكال ترمينولوجي نخترجم يشجرن ديو جن خفتنيه مالتيو كلتينا خوينا بزعبا فاكسينيشن زملكت نتهزبنا خفلت الله ننبلو نحجي قداماي كفلي كنت حلال فينا نسعب كعزدل نحرالو بحطهم كنملو سينا مالتيو أبز خنريو زلنا انتايو كلنا بزعبا كتبات يو توقيه اي توقع خوني نبل أبز تفلالو يبوتاون كيدي يعني أدالت كيرز خد كلو نيرو كتبات كقلص كاللهو نقواليك نقرا نوديك نقرو إزو يوم زبلوني تم عبيت مالتيو بتوسخون كالاي توقيه زحلف اوان كالي أيلينن زبلون علو حجن تاينا نقبر ندل زلنا نحنا حفتخمن قالكم من زخونة دانايت بقلتي اندحر عفليتكم وو حدا سب كتبات زوهب أب كندي عدمويو انت عينت كتبات كأي زوهب كندي جيزي خوهب علو زبل مسن فلت فلتات مسن عدا بعلتنا خنملو سينا مالتيو إننا خنحلون دحر دلينا كنفلطو لنا سلازي أو خندهمينا مالتيو نخلو كنبصحو إنا حدا بحدا أقديمه جن قالي دانايت هابزي الله دانايت قالي نيرس براكتيشنريا بعلا حموم الترقي diagnose تقبر prescribe تقبر نفعتي nurse practitioner حزقنا بقى مخلفكم زمن البا زيت فلطوا كتكونوا سلتخولو بعلا introduce كتقبر يا مالتيو بعلا قتلالي يا مالتيو. So today we're gonna go over vaccinations so we will know when to get vaccinated, at what age, how often. Danait is going to explain everything in detail. So we will be aware. Now, I'm going to turn this to Danait. Thank you for coming.
Thank you.
I do appreciate it very well.
Thank you for having me.
Thank you. First, I would like for you to introduce yourself, your name, which school you went to, where you work, how many years.
Sure. My name is Danait Abraha. I'm a family nurse practitioner. I have been a family nurse practitioner for 4 years. I have been, before that, a registered nurse for 10 years, so 14 years total as a nurse. I went to nursing school here in Denver at Regis University. I got a Bachelor of Science in Nursing. I have a bachelor's in physiology from University of Colorado Boulder, and I got my master's degree at CU Anschutz here in Aurora. I got my Master's of Science in Nursing as a family nurse practitioner.
Beautiful. I love it. I love nurses anyway, special nurse practitioner on top of it. They work hard. We can depend on them. They're very knowledgeable. So a good job. Myself, if I need to introduce, I'm Lemlem Yohannes. I'm a health professional I'm a pharmacist. I work, I guess we both work for Kinsupers, for this big, beautiful, nice company. I have worked there. I'm still working for 30 years. I've been a pharmacist. That's it. And I went to school, the same, here in Denver. I graduated long time ago, in 96, 30 years ago. So I'm senior. Now, on this vaccination, we both do it. I've been giving thousands, maybe 100,000, maybe 10,000, I don't know. Every day, that's what I do. You do the same thing.
Yes.
Now, I'm gonna ask you, we can both elaborate this, but I want you to be able to go in detail, maybe 2, 3 at the beginning, and so forth, and explain what vaccination is for what, how often, how old you have to be. Let's start with hepatitis V. The second will be pneumonia.
Okay. So vaccinations, I think sometimes people don't understand why we get them. So vaccinations are to protect us and give our body immunity to certain viruses that are out there. So they've been around for a very long time. So hepatitis B is a virus that affects your liver. So it can cause an inflammation of your liver, damage to your liver, which can cause liver failure and has a lot of subsequent health issues that can happen. Your liver is used to detox your body, get rid of toxins in the body. So if your liver is not working properly, then your rest of your organs will also have issues. So hepatitis B vaccine is actually given for children starting from the day that they are born. Within the first 3 days that they're born, they'll receive their first dose. They'll receive a second dose about 1 month later, and a third dose about 6 months after that. Generally, hepatitis B is given in infancy. For many people, if they did not get hepatitis B as an infant, you can still get it even as an adult. It is still in the same 3-dose series, so you get one. 1 month later, you get a second one. 1 month later, you get the third one. It's very important to get all 3 doses so that you have the full immunity. Hepatitis is a virus that can be contracted in different ways. So there's different types of hepatitis. Hepatitis B specifically is transmitted through blood, through semen, through saliva. And therefore is why, especially if you are a healthcare worker, if you work in a hospital, if you're a CNA, anywhere where you are exposed to blood and other bodily fluids, it's very important that you are vaccinated against this, as it is for all of us. There is also hepatitis A vaccine. Hepatitis A is same as a hepatitis virus that affects the liver, but hepatitis A is actually passed through food and water. So very important when we're traveling, we're going back home, we're going to other countries, or even here in the US, sometimes there's hepatitis A outbreaks due to meat that's not stored properly or cooked properly. So to protect yourself against that, hepatitis A vaccine is given as a 2-dose series. So you get 1 shot, 6 months later you get the second. They do offer this vaccine together. To get both hepatitises is usually the easiest way. You get protection from both, and you don't have to get 2 separate vaccines. So it is recommended for everybody starting from childhood through adults.
Very good. Thank you very much. كنت سمعنا يو كم زخن ملينا نوعل أبصراحة خون كله حدا patient وكا حدا حموم كمتس خله نمنتايز وسطو كندي يعدمو معاسيخم اللس زلوو اندابلنا إنا نقلصو زي صبق مردات هيباتنا الله هيباتيتس زبحال تصليم كبدي نبلو مالتي بعدنا تصليم كبدي كحمم كله أبعدنا حجي عفش واحد زوي بحال عينو بيتش أخوينو هدي ناي كبدي صقم مالتي ناي تصلام كبدي كل تعينت الله إن بي اتحادة مدالبات كن كاب عد نبكالي عد خن كيدن كلنا زتقمنا مالتي تخكل زي كنا مجبخن ملع خلنا ما انت خينا حمم زحجزنا يو اتخالي هيباتيتس بي زبحال كأني تحلال فايو بدم زي عيننا بجاخ خون كنشين كلنا ويدق عني صليم زخون ملكتات هالو ندحر أو بس إحنا مالتي ندحرتي ليفر حميمو مالتي ويكات فداتو ويسلم كبد زبلوه مالتي حجي بتنجليزينيا سلز تمهرنا إذا شجرنا زلوا بتجرينا خنزاربو يدكمنا قرقر يبلنا حسب موقت يجبرلنا سلازي نزيجن كي يخون اتياس اللام كبدي حبيقوم نجار يزلوه بزوح نجاريات تصاري بزوح نجاريات تسرح نزا بزوح تسرح دعني اندحر دعني حميمة بزوح صعبين يمتص مالتي كنت حجي دانايت قالي تقول صوت انحت نسو خي يخون ايو حجي تنوقو زلنا بقصري قدم اب حدا ورحي توقع تملس كاب كالعي ورحي تخالعي توقع تسالساي كاني شدشت ورحي خافت قداماي ورحي اندحر سلستي سيريس رخيبكا اذا صقم زي اي متصني مالت امو انا قربتي زتنكفو زلو بدنب غيرا دانايت سلتغلصو زلا نسا اصبيق اسفيحه ክትገልጾና عدل كبا ስለዝደሊ ዘለኹ አነ ንሽተይ ጭንግፍ ዘብሎ ዘለኹ ማለት እዩ ስለዚ ናይ ጸላም ከብዲ እትባሃል የሕዝ ክትገልጸና ዝኻለ ጸንሐት ማለት እዩ ካብኡ ሓሊፉ ኸኣኒ ኑሞኒያ ንብሎ ኸኣ እንታይ እዩ ኑሞኒያ እንታይ ዓይነት ቫክሲኔሽን እዩ ዘልየና ዳናይት ጓለይ ክትገልጸልና እዩ
So pneumonia is a virus that attacks your lungs. So there's viruses that are pneumonia. There's also bacteria that are pneumonia. Pneumonia is something that can affect everybody. So from childhood to adults, it is much more dangerous in the older adults. This is why it's recommended for all adults age 50 and older. So in the last 5 to 10 years, there has been an increase in the number of older adults hospitalized because of pneumonia. It can cause lung failure, respiratory failure, which can lead to heart failure and kidney failure. Pneumonia can be contracted through the community. So if somebody has a virus or they get the flu or they get COVID, that can become a pneumonia in their lung. As infants, children are vaccinated against there's 21 strains of pneumonia. Yeah. So we vaccinate children at a young age for the kinds of pneumonia that affect children, ones that cause ear infections, ones that cause other viruses. As adults, there is still these 20 strains of pneumonia that are causing hospitalizations. So last year, the Centers for Disease Control, they actually lowered the age for vaccination for pneumonia from 65 to 50 because they were finding a lot more adults, even in the 50 to 65 age, were being hospitalized or and having severe complications from pneumonia. So the goal is we lower the age so people are getting protection sooner in their lives. There are certain groups of people that should be vaccinated before the age of 50. This is going to be people who have certain medical conditions. If you have severe asthma, if you have any severe lung disease, if you are immunocompromised, meaning if you have cancer, you're taking medications that make your immune system weak, we will recommend an earlier vaccination. Otherwise, it's a recommendation for everybody starting at 50. It's only now with the new vaccinations that are out, it's a one-time vaccine. So you actually only have to get the vaccine one time, and then you're done with it for the rest of your life.
Yep. اتحجي خا نبلو زلنا نمونيا مالت عباي سعل مالتي عباي سعل كم نفلطو كنديناي كتسعل بخا كم زوت بمحر مسعل زي تشست زعف البخا كنديناي كم زحمكا نفلطينا يدك مكا قرقري بلكا تفاسون زحصركا خونيو مالتيو لذي نمونيا بزو حزبي زقتل بزو حزبي اب هوسبيتال زقتو ايو زي عبي سعل زبحال قل كتبات اللو نعو ات ختبات نزي قدم حجي حدا ختبات تخاتيبكا ንዓመታ መጺኻ ኣብ ካልኣይ ትደግመሉ ነይሩ ሕጂ ግን ካሊ preliminary 23 or the other ones ሓንቲ ተኸቲብካ ብሰላም እትነብረሉ ማለት እዩ እቲ ኣይሕዘናን ማለት ኣይኮነን ተመሊሱ ወላ ክትባት ምስ ሓዝና ወይ ከዓ ምስ ተገበረልና ምስ ተኸተብና ኣይመፀናን ኣይንሓምምን ኣይኮንናን ንብል ዘለና ግን እንተ ሓሚምና እውን ቀሊል እዩ ዝኸውን ጉዝጓዝ ስለንገብረሉ ዘለና እቲ ቫክሲኔትድ እቲ ክትባት ስለንገብር ዘለና ነብስና ተኸቲቡ ስለዝጸንሕ ከምቲ ዘይተኸተበ ሰብ ክንከውን ኣይንኽእልን ዝሐሸ ውጽኢት ይህልዎ ማለት እዩ ካብ ሞት ንድሕን ካብ ሆስፒታል ብዙሕ ግዜ ምዃን ንድሕን ስለዚ ኒሞንያ ዝበሃል ከምቲ ጓልና ዝገለጾቶ ከኣኒ ዓብዪ ሰዓል ማለት እዩ ንዕኡ እንኽተቦ ልዕሊ 50 ዓመት እንድሕር ኮይና ክንክተብ ንኽእል ኢና ማለት እዩ ሕዚ ናይ ኒሞንያ ኢና ንዛረብ ዘለና አንተቦ ናይ ሄፓታይተስ ወይ ከኣኒ ናይ ሊቨር ናይ ጸላም ሰዓል ናይ ጸላም ከብዲ ኢና ንዛረብ ጸኒሕና ሕዚ ካብዚ እሞ ክንቅጽል ደናይት ክትገልጾ ዝደልያ we can go to Shingrix.
Shingrix?
Yeah.
Okay.
Yeah.
Shingles is a virus. Many people can be affected by this. Mostly we find this in older adults, which is why the vaccine recommendation is starting at age 50. But even as a practitioner in the clinic, I see people in their 30s. I've seen teenagers who get shingles vaccine or shingles outbreak. So shingles is a very painful rash that will appear. It always appears on one side of your body only. It starts as a few red spots and it will spread quickly. It causes a lot of pain. It is a very painful rash, kind of the virus lives on the nerves in our body. So the pain is very deep. You feel it kind of like an aching and a soreness. Shingles comes from the same virus that's the chickenpox. So many of us, we had chickenpox when we were kids. If you had chickenpox when you were a kid, then you have the shingles virus in your body. With the shingles vaccine, what we're doing is we're hoping to suppress that virus so that it does not become active and cause the outbreak of this rash. The rash can last 2 to 3 weeks, and for some people, they have months when the rash has disappeared, but they continue to have the pain from where the rash was. A lot of times it's on your body, but you can get the rash on your face, in your eye. If it appears in your eye, it can be very dangerous. It can cause, you can lose your eye, you can lose your vision. We call this a medical emergency. Yeah. The shingles vaccine, it was actually made many 20 plus years ago, but in the last 10, 15 years, they've actually made an improved vaccine that they've found has a very high, greater than 90% effective rate of blocking the shingles virus from being shown. So it doesn't mean that you don't have the virus, but the virus is always living inside of us, but it will not come and cause the rash, cause the complications and the pain that comes with it. So at 50 years old, we will recommend this to everybody. It's a 2-dose series. So you get one shot and then after 2 months, you come back and you get the second shot and then that's it for the rest of your life. I think a lot of hesitation with shingles vaccine is it makes your arm very sore. Yes. It makes you feel kind of achy. This only lasts for about 12 to 24 hours. After that, you feel like normal. What I tell my patients is the shingles rash pain can last up to a month or more. So it's better to have a little bit of pain for one day than to have a cause of having pain for months sometimes.
Yes, I agree with you. So shingle ዝበሃል ኣነ ብትግርኛ እንታይ ከም ዝበሃል ኣይፈልጦን እየ ግን ብጣዕሚ ሕማቕ ዝኾነ ሽፍ ኢሉ ይወፅእ ኣብ ሓደ ገጽ እዩ ዝወፅእ ኣብ ሕቆ ክኾን ይኽእል ኣብ ሓደ ገጽ ኣብ ዝኾነ ነብስና ክወፅእ ይኽእል እዩ ማለት እዩ ሕዚ እዚ ብጣዕሚ እዩ ዝሕክኽ ብጣዕሚ ቃንዛ ኣለዎ ይሕክኸካ እንደውም ሓደ ሰባት ኣብ ገጾም ይወፅኦም እሞ ክሳብ ዓይኖም ክበፅሕ ይኽእል ዓይኖም እውን ክስእኑ ይኽእሉ ብጣዕሚ ካብ ስራሕኻ ትጎድል ኣብ ሕክምና ክርተት ትብል እሞ ከዓ ዘሎ ቃንዛ ኩሎም መፂኦም ክዛረቡ ከለዉ ሕሙማት ክንሰምዕ ከለና ተትፈልጥ ነይረ ክልተ ዶስ ክልተ ግዜ ተወጊኤ ዝሕሸኒ ምዃኑ ተዝፈልጥ ነይረ እዚ ቃንዛ እዙይ ሕዚ ኣይምንተቐንዘኽዎን ነይረ ኢሎም ዝናስሑ ኣለዉ እዚ ቺክን ፓክስ ትብለና ፀንሐት ጓልና ከዓ ዳርጋ መብዛሕትና ኣለና ኣብ ዓድና ከለና ዋላ ብዚ ሕጂ ከምዚ ሓሪሱ ደኺሙ ይፀንሕ እሞ ገለ ሕማም ክመፅእ ከሎ ካብቲ ነብስና ይለዓል ማለት እዩ ተመሊሱ ይሕመና ዝሽንገት ዝበሃል ይፈጥር ኣብ ካሊእ ቃንዛን ስቃይና ኣቱ ማለት እዩ ሓቂ ሕይሽ ብእንግሊዝኛ ዝቐለለት ክትገልጽ ግን ንዓኣ ስለ ዝሃብክዋ እቲ መድረኽ ናይቲ እንግሊዝ ኣነ ብትግርኛ ከዓ ቁርብተይ ብዝኸኣልክዎ እየ ዝገብር ዘለኹ ፅቡቕ ገይረ ዘይገለፅክዎ ክኸውን ይኽእል ብዝኾነ ክልተ ዶስ እየ በቃ ካብ 50 ዓመት ንላዕሊ ንዝኾነ ሰብ ቅድም ሓንቲ ይወጋእ ድሕሪ ኣብ 2 ወርሒ ክሳብ 6 ወርሒ ዘሎ ግዜ ከዓኒ ተኻልአይቲ ዶስ ንህቦ ማለት እዩ ስለዚ ካብዚ ኩሉ ሳሕን ስቃይን ነብስኻ ሽፍ ኢሉ ብጣዕሚ እዩ ዝኸፍእ ክትሪኦ ከለኻ እንድሕር ክኢልና እቲ ስእሊ ኣብኡ ፖስት ክንገብሮ ኢና ከመይ ዓይነት ምዃኑ ምእንቲ ክፍለጥ ማለት እዩ ካልአት ካብኡ ዝነኣሳ ካብ 50 ዓመት ዝነኣሱ እንተልዮም ካብ 19 ክሳብ 49 ዓመት ዘለዉ ከዓኒ pre-existing condition or at risk ዝኾኑ ንብሎም ማለት እዩ እዚኦም ክሓሙ ይኽእሉ እዮም ወይ ከዓ ካልእ ሕማም ኣለዎም ስለ ዝኾነ ኣብ ሓደጋ ከብፅሖም እዩ እንብሎም ሰባት እንተልዮም ከዓኒ ክውግኡ ይከኣሉ እዮም ማለት እዩ ወይ ከዓ ብዳክተር ተኣዚዙ ክወሃበለዎም እንተተባሂሉ ክትባት ንህብ ኢና ማለት እዩ ሕዚ ከዓ ናብ ካሊእ ከስግረኩም ይቕኒየለይ ደናይት ጓለይ
I would say too, shingles, it comes when you are sick, but it also can come when you're under a lot of stress. So if you work a stressful job, something stressful is happening, a lot of times this is when the vaccine will come because your body sees that as weakness and that your immune system is not well, even when you're just having a stress from your job, from your life. So it can really happen to anybody.
Beautiful. Now, I'm flipping to choose what I want to ask you.
Okay.
What's better? What is useful for us?
RSV is a newer vaccine. It came about 3 years ago. RSV stands for respiratory syncytial virus. So this is another virus that attacks the lungs. So this causes a lot of hospitalizations, people needing to be on a ventilator. It is very dangerous for infants and for the older population. So for a long time, there were some vaccines for infants. We would give them as babies, but there was not really any protection for older adults. So they've come with the respiratory syncytial virus. It is recommended for everybody 75 years and older. So it's really this group that has a lot of risk when they get RSV. And when you think about it, grandparents, this is a grandparent age, they're around a lot of toddlers and little kids, and they are usually the ones that bring the virus. They go to daycare, they go to school, they're infected with the virus. This virus is very prevalent during the winter months. So starting from about September, October until about February, and even in some years like this year, the virus has been very bad, so they're calling it a late year. So even in March and April, we're still considering it part of the year for it. So 75 and older, it is recommended. They have the highest risk of being in the hospital with this. It is also recommended for anybody from the ages of 60 to 74 if, like we talked about in other things, if they have certain medical conditions, if you have asthma, if you have any kind of a lung disease, if you're immunocompromised, where if you got this virus, it would cause you to be hospitalized. The other group that outside of older patients that this vaccine is recommended for is actually pregnant women to get it during weeks 32 to 36 of their pregnancy. This is very important because as the mom, if you get the vaccine while you're pregnant during this time frame, you pass this immunity onto your infant. This gives your baby protection, especially when your baby is born during these winter months. Many kids in the winter are hospitalized with RSV, from infants that are 2-3 months old to children that are 3 or 4 years old. So getting this while you're pregnant, your doctor will recommend it. It's a new recommendation that they're able to give it to these pregnant women, and it gives your baby protection through you. So we really recommend it for women, especially when you're delivering a baby during the RSV season. You know, you have a baby, people come visit you, or maybe you have other children in the home, they go to daycare. They're going to be the ones that bring this virus. It's spread through the air, through coughing, just like any kind of a flu, but it is very damaging. It causes a very severe cough, a very severe inflammation in the lungs that makes it hard to breathe. And this vaccine has a pretty high rate of efficiency and protection.
Yep. Very good. يغني دانايت حجها RSV تبلو زنبرت كم زي سعال مالتيو سعال كوينو ناب كله زتحلالف أب كله ززرع هتي شيء كتبل ديو كسعل ديو بتعمي زتحلالف مالتيو مغوت يقبرلكا ويزين تايز بحال قرقات يبل عفنش أخارانينو زي هلوكا مالتيو بزح سلازي زي RSV زبحال بتعمي زسعل تختقتها زي كونسي كم سعال مالتي حزب مبزحت جيزي أب قر خون كله أب كرمت خون كله إذا سعال يبزح نب كله قولعونا أشتو أب دكير خدو خلو كاب دكير حزمكم خلو كالتيفو نب كله يزرع يحلف مالتي نعبيتي ني عقم زي بلوم قلطيفو يتقع نقولعو قلطيفو يتقع مالتيو ويك إيمين سيستم بزح تررت زي كونه سب اندحر كوينون كتقع يخيل مالتيو اتملكتو افنጫና ዘረብረብ ይብል ኮንጀክሽን ይሕዘና ምግቢ ኣብየና የስዕለና ህጥሸ ይብለና ሙቀት ይገብረልና እዚ ኩሉ ምልክታቱ ማለት እዩ ከምቲ አንተ ወዝገለጾቶ ንዑኡ ክትባት ኣለዎ እቲ ክትባት ንሱ ሓንቲ ሰብ ተክትባት ወሲና ካሊ ኣየልየናን እዩ ማለት ፍርቁ ሓደ ግዜ ተወስዶ ወይ ክልተ ግዜ ሰለስተ ግዜ ተወስዶ ኣሎ እዚ ግን ሓንቲ ያ ሓንቲ ወሲድካ ነፍስኻ ትከላኸል ማለት እዩ ካብ በተወሳኺ ጥንስቲ ምስትኸውን ካብ ኣብዞም ዓዲ ብሰሙናት እዮም ዝቆፅሩ ኣብ ዓድና بورحي زغصر لكن دي ورحي 3 ورحة 4 ورحة أبزي قل بسومونات سلز قصر كاب 30 كلتن سومون زلو أب قلعة بدن بيصبو غيرو ذات ثاني صلو جيزة مالتي كاب شعو جيزة تختب حجي تولد نكلا نتقول عطعنا نعاني تعنا زتحلو يخون مالتي تنستي كاب 30 كلتن سومون مسكونت كالي إسب كاني كاب 5 عمت نلعلي زلو كنهم نخلينا بفارماسيست ريكومنديشن اندحر كوينو مالتيو زي بتعمي زت حلالف حماق سعال سلازخوني بفلاي أبقر جيزي زبازح سلازخون كتبات كنقبرون كتبات كنوسد لنا مالتيو كنكالاخل بصفيحو داناي سلت قلت أزلا يعني زحصر حصر زبلو زلخو كابزي حليفنا ناي مأخل عدمة زلو كن كيدينا دانايت Garcer the HPV vaccine is given for the younger one.
Yeah.
So can you explain about it?
Yeah. So HPV vaccine. It's been around for a little while. The youngest age that your child can get it is 9 years old, and up to the age 45 we give this vaccine. I would say for me, when I'm seeing teenagers and children in the clinic, my recommendation is usually about 10 or 11 to give it to them. This is when they are about to start middle school. They have a few vaccines to get. HPV vaccine is very important. It's called the human papilloma virus. So this is a virus that is easily transmitted. It is transmitted through sex. So I know a lot of people's hesitation is, my child is 9, 10 years old, they're not having sex. I understand that, but down the line when they're older, we want to give them the protection now before they've had any exposure to this virus. HPV vaccine a long time ago, it was considered something they only thought for girls or for women because it was the cause of a lot of cervical cancer. So we used to think, people would think it's only for women because it's a cancer for women, but that is not the case. A lot of more research in recent years has found that the HPV virus actually causes a lot of cancers, not just cervical cancer in women. It causes throat cancers, it causes neck cancers. It is the cause that they're finding for a lot of cancers. So the reason that we start recommending this at a young age is because it's not a virus that has a symptom. A lot of people carry this virus, they have no idea. And it's just being passed from person to person. There's no way to know I have it or I don't have it. So the best way to protect your children is to get them vaccinated when they are young. When they're young, if they get it before the age of 15, it is a 2-dose series. So they get one vaccine, between 6 and 12 months later, they get their second one, and then that's the only time they have to get that vaccine. If you choose to wait maybe for them to be a little older, if they get it after 15, they just have to get it 3 times. So they get it at 0, they get it at 1 month, and then they get it at 6 months. It's a very important one that is, I think, we push a lot and we discuss a lot with patients when they see us because of the prevalence of how we're finding that it's causing all these cancers that we did not know it was responsible for. So the earlier you can give this to your child before they are exposed to this virus, the better protection that you are giving them. So that's why the recommended age starts at 9. After 45, it's not as recommended, but anybody from that age. So if you didn't get it when you were a teenager, or like for me, when I was a teenager, it wasn't around, so I got it when I was older. It's not too late to get it just because you're not a teenager anymore. We just recommend it at that age, just so that we can catch children at a younger age. But anybody can get it, even if you're 25, 30, 40 years old, you can still get this vaccine.
Right. ስለዚ እዚ ጋርድ ሴል ዝበሃል ቫክሲኔሽን ዝጠቕመና ብፍላይ ንደቅና ኣናእሽተይ ከለዉ ዝወሃብ እዩ። እዚ እውን መብዛሕትኡ ግዜ ዝተሓላለፍ ብሴክሹዋል ብርክክብ መብዛሕትኡ ግዜ ዝተሓላለፍ ናይ ማህፀን ካንሰር፣ ናይ ርእሲ፣ ናይ ክሳድ ከምኡታት ዝኣምሰሉ ከይመፅእ ወይ ከዓ ከይንሓምም ዝከላኸለልና ማለት እዩ። እቲ ኣነ ኣፀቢቐ ስትረስ ክገብሮ ዝደሊ ግን እዚ ቀዳማይ ከምቲ ዝበለቶ ዳናይት ቀደም ናይ ኣንስቲ እዩ ናይ ጓል ሕማም ተገይሩ እዩ ዝውሰድ ነይሩ። ከምኡ ይኮነን፣ ወዳት እውን ኢንክሉድድ እዮም ኣብዚ ማለት እዩ። ካልኣይ ንምንታይ ይመስለኩም ኣቐዲምካ ክወሃብ ኣለዎ እዚ ቫክሲኔሽን ዝበሃል? እንድሕር ደኣኒ ደቅና ኣናእሽተይ ከለዉ እንድሕር ተኸቲቦም ጋርድ ሴል ነቲ ንእስነቶም እንዳዓበየ ኸይዱ ምልላይ ክጅምሩ ከለዉ ኣክቲቭ ክኾኑ ከለዉ ሴክሹዋሊ ኣክቲቭ ክኾኑ ከለዉ ዓርኪ ክሕዙ ከለዉ ቱሌት ይኸውን ማለት እዩ። ብኡ ዝመፅእ ሕማም ስለ ዝኾነ ኣቐዲምና ደኣኒ እንድሕር ዘየኽቲብናዮም ፀኒሕና ንዑ እውን እዩ ንእሽተይ ከለኻ ዝውጋእ ወይ ከዓ ንእሽተይ ከለኻ ካብ 9 ክሳብ 14 ወይ ካብ 15 ክሳብ 16 እንዳበልና ንኸዶ ዘለና ኣቐዲምና ክውግኡ ክኽተቡ ዘለዎም ምኽንያት ንኽትከላኸል ማለት እዩ። ዓቕሚ ኣዳም በፂሕኻ ምስ ካሊእ ርክክብ ክትፈጥር እንከለኻ ፀገም ስለ ዝፈጥረልካ ናይ ሰርቪካል ናይ ማህፀን ድዩ ናይ ካሊእ ድዩ ካንሰር ከምፅእ ስለ ዝኽእል ኣብኡ ከይበፅሑ ከለዉ ደቅና ክኽተቡ ከም ዘለዎም እዩ። ብጣዕሚ እዩ ኣድላይ፣ ብጣዕሚ እዩ ክንፈልጦ ዘለና። ምክንያቱ ኩላህና መናእሰያት ስለ ዘለውና ማለት እዩ። ከምቲ ዝበለቶ ዓቢኻ እውን ክትውጋእ ትኽእል ኢኻ። ሬኮመንድድ ኣይኮነን፣ ብንእሽተይካ ክትውግኦ እዩ ትዝሐሸ። እዚ ሰራዊት ተቐሚጥካ ምጽናሕ ማለት እዩ ብሓጺሩ ነፍስኻ ነፍሲ ደቅኻ ተኸላኺንካ ምጽናሕ ጽባሕ ንጎሆ ናብራን ሓዳርን ክግበር እንከሎ ካብ እቲ ሕማም ትከላኸል ማለት እዩ ምክንያቱ እቲ ሓደ ምትሓላለፍ እዩ ስፕሬድ ዝገብሮ ብሴክሹዋል ኣክቲቪቲ ስለ ዝኾነ ማለት እዩ እዚ ሰርቪኮ ቫጂኖ ጀኒታል እዚ ኩሉ ዝከላኸል ነዚ እውን እዩ ኣብ ፕራይመሪ ዳክተር ክኸይድ እንከሎ ቴስት ዝግበር እዚ pap test
pap smear
for women ዝግበር ንዑ እዩ ለዚ በጃኽን ኩልኽን እዚ ከና ቸክ ንገብር ከም ዘለና ንደቅና እውን ክንዕጥቆም ከም ዘለና ማለት እዩ እቲ ክትባት እንድሕር ዳኣና እሽቱ ከለው ወሲዶም ዳሕራይ ዓብዮም እቲ ሕማም ኣየጥቅዕን እዩ ኢና ንብል ዘለና thank you for covering that and the other one is mostly I call it a college vaccination
yes meningitis yes so meningitis vaccine is given to recommended is at 11 with a booster dose at the age of 16 so meningitis is a viral disease it's a virus that affects your brain and your spinal cord so if you and it is transmitted through the air so us coughing breathing on each other so it can cause an inflammation of your brain of your spinal cord it has a very high rate of death when you are infected by this there's bacterial meningitis and there's also viral so this vaccine is to help protect and there's many meningitis viruses so there's the vaccine that we give it protects against the 4 strains that we know are very easily passed so the reason we start this at age 11 when kids are in school they're having more exposure to people that they get this and then at age 16 they need to get a booster dose the reason we call it the college one is many colleges if your student is going to college they're going to live in a dorm room with hundreds of people most colleges require this vaccination before you can come live in a dorm room because it is known that meningitis virus is actually spread very easily when people are living in close quarters so dorm rooms anywhere where people are sharing a lot of space so we recommend this vaccine to give it to them when they're younger they'll get it at 16 there's 2 different meningitis vaccines so the one we give at 11 and 16 covers 4 strains we have another meningitis B vaccine that is recommended at age 16 and then the second one is given I believe in 6 to 12 months after that that is another one it just covers a different strain of the meningitis virus also one that's recommended especially if your child is going to go live in a dorm room going to travel overseas be anywhere where you can be exposed to this meningitis is hard because by the time you realize that you have it and you're very sick there's very little that we can do to help at that point so that is why we want to protect our kids before they get to that age
okay meningitis ክበሃል እንከሎ መብዛሕቲ ግዜ ምስ ናይ ሓንጎል ዝተተሓሓዘ እዩ ንሕና ክንጽውዖ ከለና ከዓ ንካሌጅ ክትከይድ ከለኻ ካብ 16 ዓመት ጀሚሩ ዝወሃብ ስለ ዝኾነ ናይ ካሌጅ ቫክሲኔሽን ወይ ከዓ ክትባት ኢልና ንቕልድ ማለት እዩ ግን ናይ ካሌጅ ጥራሕ ኣይኮነን ኣብ ናይ ካሌጅ ማንዳቶሪ እዩ ኣብ ዝበዝሕ ቅድሚ ካሌጅ ምእታዎም ደቅና እቲ ቫክሲኔሽን ይውሰድ ማለት እዩ ሕዚ እዚ meningitis ዝበሃል ማለት እዩ ብባክተርያ ክትሓላለፍ ይከኣል ፋንገስ ክትሓላለፍ ይከኣል ፓራሳይቲክ ክትሓላለፍ ይከኣል ማለት እዩ ብዚ ሰለስተ መንገዲ ሙቐት ክገብረልና ይኽእል ርእስና ክሕመና ይኽእል እዚ ክሳድና ስቲፍድ እዚ በቃ እዚ እንታይ ዝበሃል ገለ ይበሃል ሽሙ ጠፊእኒ ክሳድካ ዝሕመካ እንቅፅ ኣቢሉ ዝሕመካ ማለት እዩ ተምላስ ክገብረልና ይኽእል ቅልውሉ ክብለና ይኽእል ዓይንና እውን ንመብራህቲ እንተርእዩ ክስምዓና ይኽእል እዚያት ካልኦት እውን ምልክት ኣለውዎ እንድሕር ሒዙና ማለት እዩ እንድሕር ሒዙ እዚ meningitis ብጣዕሚ ኣብ ሓንጎል ስለ ዝኸውን ዝኣቱ ሓደገኛ እዩ ኣብ ሞት ዘብፅሕ እዩ ብጣዕሚ ሓደገኛ ዝኾነ መንንጃይተስ እዩ ማለት እዩ ግን ክንከላኸሉ ንኽእል ኢና ቅድሚ ካሌጅ ምእታዎም ወይ 16 ዓመት ከለዉ እንድሕር ክትባት ሂብና ካብዚ ሓደገኛ ዝኾነ እንተሒዝዎም ክንከላኸል ንኽእል መብዛሕትኡ ከዓ ዝተሓላለፍ ከምዚ ቀልጢፉ ስለ ዝተሓላለፍ ኣብ ዕፁብ ዝኾነ ቦታ ንምንታይ ኣብ ካሌጅ ተመሪፁ እንድሕር ኢልና ኣብ ዶርም እዮም ዝኾኑ ደቅና ብሓንሳብ 3-4 እዮም ኣብ ሓደ ዝኾኑ ክራውድድ ኣብ ዝኾነሉ ቦታ ሃፋት ንሃፋት ኣብ ዝወሃበሉ ቦታ ኣብዚ ቀልጢፉ ስለ ዝተሓላለፍ እዩ ንካሌጅ ከኣትዉ ከለዉ ዝወሃብ ማለት እዩ ግን ኣብ ካሌጅ ጥራሕ ኣይኮነን ኣብ ካሊእ እውን ቦታ ክራውድ ዝኾን ከምዚ ነርሲንግ ሆም ብዙሕ ሰብ ዘለዎ ክትሓላለፍ ስለ ዝኽእል እዚ ናይ መንንጃይተስ ዝበሃል ክትባት ኣለዎ በቲ ክትባት ገርና ንደቅና ካብ ናይ ሓንጎል ሕማም ካብ ሞት ክነድሕን ንኽእል ኢና ማለት እዩ The other one that I want you to go over is for the Tibeb.
Tibeb, yeah. Yes. So Tibeb is one of the few vaccines actually that you have to get more than one time or more than one series. So Tibeb vaccine, it covers actually 4 diseases. So it covers tetanus, which is a bacteria that enters your bloodstream if you get cut, if you step on a rusty nail, if you get bit by a dog or by a cat. And tetanus is something that once it's in your bloodstream, once it is in your body, the death is very quick and it's very painful. It basically causes all the muscles in your body to become very tight and very rigid. It's very painful for people. So that is why we are always asking about tetanus vaccine. It also covers diphtheria, which is a virus that affects your throat. So if you have diphtheria, causes a closing of the throat, can make you stop breathing. And then it also covers whooping cough or pertussis. Whooping cough is a virus that most of the time we see in little children because once again, you know, they go to daycares, they have a lot of coughing, sneezing. Whooping cough is a very severe cough. It causes a whooping kind of sound, which is why they call it that. It's a really severe cough, coughing until the kids are vomiting and you can get this even as an adult. So if your kid brings it home, you're at risk of getting it. The cough can last more than 4 weeks. And some people can be hospitalized depending on how severe the coughing becomes. So this vaccine, the first age to get it is age 10. Generally, and when your kid goes to school here in Colorado, they are required to have it before they enter middle school. So most kids will get this before the 6th grade. As children in ages between 1 and 5, they actually get a similar vaccine. It's called a DTaP. Helps cover them for similar whooping cough. But at age 10, we go to Tdap. Tdap is actually recommended every 10 years. So everybody routinely should be getting this vaccination every 10 years. If you say you were to cut your hand or you stepped on something rusty, if you go to urgent care or emergency room, if you have not had this vaccine in 5 years, they will revaccinate you. This is perfectly safe. The reason we do that is because we're worried about that tetanus, that bacteria that enters your bloodstream from rusty nails or sharp glass or steel. So if you haven't had it in 5 years, we will give it to you just to make sure you're protected against that tetanus vaccine. Otherwise, it's recommended every 10 routinely. The other time that you might get it more often is if you are pregnant. So pregnant women at 28 weeks, your OBGYN will recommend that you get a Tdap vaccine. This is so that the baby is receiving protection from that tetanus, from the whooping cough, from the diphtheria. In an infant, whooping cough can be very fatal because they're very small, their lungs are not very mature, so for them to get a virus that's serious is very dangerous for them. So that is why they vaccinate women at 28 weeks, and they will probably also recommend anybody in your household, anybody who's going to come be around this baby should also get vaccinated. So the husband, the grandparents, anybody who lives in the house, if you're unsure if you've had the Tdap, they will recommend everybody get it just so that nobody is exposing this newborn child. It's very safe to get in pregnancy and is recommended and will be recommended by your doctor. After that, it's just every 10 years, even no matter how old you are, it will be recommended to you.
እሺ ጽቡቅ ጌራ ገሊጻቶ ስለ ዝኾነት ብዙሕ እኳ ኣነ ዝውስኸሉ ነገር የለን ግን ታ ፀቢቐ ስትረስ ክገብራ ዝደሊ እንታይ እዩ ሓንሳብ እንድሕር ደኣኒ ተኸታቲልካ ትውግኦ እንድሕር ፀኒሕካ እቲ ቫክሲኔሽን ብድሕሪኡ ዘሎ ሓንሳብ ኣብ 10 ዓመት ኢኻ ትውጋእ ግን ኣብ ማእኸል ትውጋእ ወይ ከዓ ክትክተብ ዘድልየካ ምክንያት እንተልዩ ንኣብነት ኣብ መስመር ኣብ ዝመረተ ነገር እንድሕር ወጊኡካ ንሱ ኣትዩ መርዙ ኮይኑ ኣብ ፀገም ከብፅሐካ ስለ ዝኾነ ታትነስ መፂኻ ትውጋእ ማለት እዩ ለዚ ነቲ ሕማም በቲ ዝመረተ ኣትዩ ኣብ ሕማም ከይትበፅሕ ትከላኸል ማለት እዩ እቲ ሓደ I don't know ብጣዕሚ እዩ ዘብል ኣብ ንኣሽቱ ቆልዑ ናይቶም ቆልዑ ኣሰዓዕላ ክትርኢ ከለኻ ተጨኒቆም እሞ ጠጠው ዘይብል ሰዓል ሃኪንግ ካፍት ዝብልዎ ኣሜሪካውያን ማለት እዩ ኣብ ኣድቨርታይዝመንት ርኢኹምዎ ትኾኑ ከምቲ ኩሉ ግዜ ንስዕሎ ዘይኮነሲ ክብድ ዝበለ ንህፃውንቲ ብፍላይ ዘሸግር እንዳበለ ዝኸይድ ማለት እዩ በቃ ሕማቕ ዝኾነ ሰዓላ ዝሕዝ ማለት እዩ ንዚያት ዝከላኸል እዩ እዚ ብጠቕላላ ኣናእሽተይ ከለና እንወስዶ እዩ ካብ 11 ክሳብ 18 ካብ 19 ንላዕሊ ጥንስቲ ከዓ 28 ሰሙን ክትከውን ከላ ክትወስድ ኣለዋ ንባዕላ ክኢላ ንባዕላ ተጠንቂቓ ንትውላዳ እውን ዝውለድ ዘሎ ሰናይ ይኸውን ማለት እዩ ፅቡቅ ይኸውን ማለት እዩ እቲ ካሊእ ኣብዚ ዓዲ ዝገብርዎ ከምቲ ዳናይት ዝገለፀቶ እንድሕር ቆልዓ ክውለድ ኮይኑ ንኣብነት ኣነ ጓለይ እንድሕር ትወልድ ኮይና ኩላህና ንውጋእ ነቲ ቆልዓ ከይሓምም ነቲ ህፃን ክንሕልዎ ማለት እዩ ምክንያቱ እቲኦም ቆልዑ ህፃውንቲ ኣይኽእልዎን እዮም እቲ ኣሰዓዕላ ብጣዕሚ እዩ ሕማቕ ክትሰምዖ ከመን እዩ ዘፅልእ እዚ ኣብ ኩሉ ከይበፃሕና ከለና እዚ ቲዳብ ዝበሃል ደኣ እንድሕር ተኸታተልናዮ እንድሕር ተኸቲብና መዓስ ከም ንኽተብ ከኣኒ ምእንቲ ከይዳናገር ኣነ ይደጋግሞ የለኹን ብዳናይ ስለ ዝወሃብ ዘሎ ማለት እዩ ውላድና ንባዕልትና ፅቡቅ ጌርና ብጥዕናና ክሕሎ ይኽእል ማለት እዩ በቢ 10 ዓመት ከኣኒ እንዳመፀና ንኽተብ the last one that I was going to ask you is the MMR.
Yes, so MMR vaccine covers 3 viruses. So we have measles, mumps, and rubella. MMR vaccine is given to children when they are 12 months old and when they are 24 months old. It is given at this young age before they have any exposure. The one that we hear and the one that is in the news right now, because in Colorado we've had 2 measles outbreaks since the beginning of 2026. So it's mostly the measles that really causes a lot of issue for people. Mumps is less common, rubella is less common, but both viruses that if you get it, you become very sick. So mumps is one, it causes the face to swell a lot. Rubella is, we call it the German measles. So it's similar to measles, but it has a little bit of a different presentation. Measles has been an issue in the last 2-3 years. There was a good 18 years, measles was basically eradicated due to everybody being vaccinated. Unfortunately, with less people vaccinating, there has been outbreaks and a lot of deaths caused by measles. So measles travels through the air. We call it airborne, similar to COVID. So the reason it's a little more dangerous, it's a very small virus, so it can travel very far. A lot of viruses like the flu, they're big, they only travel 3 feet maybe before they die. Airborne vaccines can travel up to 6 feet, 9 feet, and they're very small particles. So measles is an airborne virus. It causes, starting with, kind of feels like a cold, a little bit of runny nose, congestion, maybe a little fever, and then about 3 or 4 days in, a rash will develop. And this rash is very specific. It starts on your head and then it moves down the body. So that is how we differentiate just a normal rash to one that comes from measles. The reason measles is also a little more dangerous and why it causes more issues and why we've had these outbreaks is because when you are exposed to the measles, it can take 14 days before you experience any symptoms. In those 14 days, you are passing this virus on. If anyone who's already been vaccinated because they got their MMR vaccine, it has a 97% effective rate, meaning that you're really not in any danger if you've had this vaccine, even if you are exposed to the measles. The people that we really worry about is that we have to go and find people who have not been vaccinated, and we require them to quarantine for 21 days to protect them and to protect other people who have not been vaccinated. So, you know, recently in the news in Broomfield here in Colorado at a high school, there was an exposure at a basketball tournament, and there was a lot of people exposed. Luckily, only so far were about 2 kids that were sick with the measles. But the problem is that it takes 14 days before we find out how many people actually might have gotten it. And then the other thing is we had another outbreak in a little more northern Colorado, a lot of it coming from people traveling through the state. People travel through the airport, they come to Colorado, then they go to all these different places and they don't realize it because they think maybe they just have a cold at first before the rash comes, before we realize it's the measles. There is really no way to treat the measles once you have it. We just support the symptoms you're having. We try to support the fever, the cough, help, you know, hope that your lungs do not have too much inflammation. People do die from the measles generally because their lungs become very inflamed from the virus. They can end up on a ventilator and they will may not survive that. So that is the reason that we vaccinate children at such a young age for it, because we want to protect them before they're having all this exposure to other kids, people outside, airports, and things like that. If you didn't get the MMR as a kid, you can still get it even as an adult, and it is recommended, especially older people. A very long time ago, in the 50s, they didn't have a vaccine. The measles caused a very severe outbreak. So a lot of people have what we call natural immunity because they had the measles. So this is, once they came up with the vaccine, is when we stopped seeing the measles and these outbreaks because everybody was vaccinated, everybody was protected. It has a very high effective rate of protection, which is why we want everybody to get it for their children at a younger age. You can, if you're unsure if you've had the vaccine, you can actually get your blood drawn and they can tell you if you have the immunity or not. Some people don't get as much immunity, you can get a booster dose to it. But this is one that's been in the news a lot because there has been so much issue with it. So it's one that we really talk with people, especially if you didn't get it as an infant, to make sure that you get it even as an adult.
Thank you. يقنيلنا صبو صبو غيرا تي ناي فاكسينيشن وكا ناي زختبات معاسينا نوسدو اب كندي عدمنا انا نوسدو كندي غيزي انا نوسدو زبل صبو غيرا دليصاتو يا كافتي حز زبلتو ميزل انتاي يزبحال بتغرينيا قبل كلخو نفيو يلومني نفيو خا مبزحتنا اب عد حلفنا يو انا مسلني نيرونا ايو ازي طفيو تباهيلو زنبريو بقى دحر حجي خمو زبحال يلن تباهيلو زنبر بزعدي مخن نمنتاي مسلكم كل سب يختب سلازنبر يختب سلازنبر كله طفي نيرو مالتي حجي دحراي اتسب بنناي بعلو مخنيات تختبات مقراص مش جمره ابوبوتو يرأي يالو ميزل اوتر بريك እንዳተባለ ተመሊሱ መጽዩ ማለት እዩ እዚ እትሕማ ሰብ ይሐምም ኣሎ ማለት እዩ ንብዙሕ ግዜ ዝጸንሕ እዩ ተሐላሊፉ ኣብ ነፍስና ንብዙሕ ግዜ ክጸንሕ ዝኽእል እሞ ብሓጽር ግዜ እሑይሉ ሰብ ከማን ኣብ ቀረባ ኮይኑ ከምሰዓል ድሕር በልከይ ትብሎ ብሩሕኡን ከርክበልካ ዝኽእል እዩ እዚ ሕማም ስለ ዝኾነ ኩላህና MMR نزي vaccination كنوصدو خمزلنا مالتيو أنا أشتغلنا نوصدو قدم توجي إيه كل ودي إيه نبل نهلو نخون ንዕኡ ክንፈልጥ እንድሕር ደሊና እውን ናብ ዶክተርና ክንከይድ ንኽእል ኢና የልየኒ ድዩ ኣየልየንን ደም ወሲዶም ይምርምሩ እንድሕር ደኣ ነብስኻ ክከላኸል ይኽእልን እኹል የብልካን እንድሕር ኢሎምኻ ናባና ትመፁ ንወግአኩም ማለት እዩ ወይ ከዓ ክትባት ኣብ ዝደለኹም ኸይድኩም ትኽተቡ ግን ኣድላይ እዩ ኩላህና ንኽተምተ ንኸውን ኩላህና ተረዲእና ፈሊጥናዮ ንሰርሐሉ እንተንኸውን ነርና ጥዕናና ዝተሓለወ ይኸውን ማለት እዩ ሕዛ ኣነ ኣብ መጨረሻ ክዛረቦ ዝደሊ I want to explain why I'm doing this. And I'm going to ask you the same thing. Why do we do this? Why are we doing this? I know it's our profession. I know we do this all day. I know we explain to each customer. But here at the Yibrah media, where everybody can hear, we're trying to reach out. Why are we doing it? Why Danait? So that's what I'm going to explain, my part, and you're going to do the same thing. Thank you. ንምንታይ ኢና ዝንገብር ዘለና እንታይ የድልዩ ንዝብል ክምልስ ደልያ ኣነ ኩሉ ግዜ ዝኣምነሉ ኣለኒ ብዓቕማ ለምለም ክሰርሖ ትኽእል ከተበርክቶ ትኽእል ትብዛሕ ትውሓድ ክትገብር ኣለዋ እያማ ናይ መንፈስ ዕግበት እዩ ብዝኽእሎ ኸበርክት ናይ ግድን እዩ ሓላፍነተይ እውን እዩ ኢለ ስለ ዝሓስብ እየ እዚ ከዓኒ ናተይ ሜዥር እዩ ዝሰርሐሉ ዝውዕል ዘለኹ እየ ለዚ ንምንታይ ትህዝበይ ካልኣይ ክኸይድ ከለኹ ናብ ዝተፈላለየ ቦታ ክሓትት ከለኹ ብዙሕ ሰብ ኣፍልጦ ከም ዘይብሉ ተረዲእኒ ኣፀቢቑ ክገልፀሉ ዝኽእል ሰብ ስለዘየለ ስለዘይተረድኦ እዩ ዝብል ግምት ወሲደ ማለት እዩ ካልኣይ ኣብቲ ሳልሳይ ዲረባዓይ ቁፅሪ ተጋጊ ክኸውን ይኽእል ደቅና ኣብዚ ዘለዉ ኣናእሽቱ ንካሌጅ ዝኣትዉ ድዮም ኣናእሽተይ ካብኡ ዝተሓቱ ድዮም ዋላ ዓበይቲ ድዮም ቋንቋ ዘይኽእልዎ ኣለዎ ትግርኛ ግን ደቅና ብዙሓት ዝተምሃሩ ዝፈልጡ ፈላጣት ከምህሩ ዝኽእሉ ስለ ዘለውና ንዚኣቶም እውን ኣድሬስ ክንገብሮ ክፈልጡ እሞ ነቦኦም ነዲኦም እዚ ማለት እዚ እዩ እዚ የልየካ እዩ እዚ ተኸቲብካ ኢኻ እዚ ኣይተኸትብካን ኢሉ ጋይድ ክገብሮም ክኽእል ከምቲ ዓንቲ በዝበልክዎ ኣብ ናይ ኣዳልት ኬር ክኸይድ ከለኹ እዚ ዕድመኻ እዚ ክትክተበለካ ክብል ከለኹ ንወደይ ክነግሮ ንጓለይ ክነግራ ከፍልጦ ንቐደም ይብሉን ስለ ዝነበሩ ሕዚ ወዱ ጓሉ ፈሊጡሎ ማለት እዩ ምፍላጥ ሓደ ትዝዓበየ እዩ እንድሕር ፈሊጥካ ዝኾነ ይኹን ትውስኖ ነገር ቀሊል ይኾነልካ የልየኒ እዩ ኣየልየንን እዩ እዚ ንዓይ ይኸውን እዚ ንዓኻ ይኸውንን እዩ ኢልና ክንከታተሎ ንኽእል ክንምልስ እውን ንኽእል ኣነ ክክተብ ኣይክእልን እየ እንድሕር ዝብል ኮይነ ምክንያት ኣለኒ ማለት እዩ ተረዲእኒ ፈሊጠ ኣየልየንን ይብል ኣለኹ ማለት እዩ እንድሕር የድልዮ እዩ ንወደይ ንጓለይ ዝብል ኮይኑ ከዓ ፈሊጡሎ ንምንታይ ማለት እዩ ንሕና ክትክተበለኩም ኢልና ይኮናን ፑሽ ንገብር ዘለና ከምኡ ይኮነን ንሕና ግን እንፈልጦን እንሰርሐሉን ሞያና ንኮሚኒቲና ንህዝብና እሞ ክነፍልጥ ክነግር እሞት ንኽእሎ ኣዌርነስ ሞይሃሉ ባዕሉ ትሰብ ይውስን ማለት እዩ ክትውስኑ ከለኹም መዓልቲ ንኣብነት ናብ ዳናይት ዘላትሉ እንተመፂኹም ናባይ ኪንስፖር ኣብ ኣውሮራ እየ ዝሰርሕ እንተመፂኹም እንታይ ኢና ንገብር መስለኩም ስቕልና ይኮንና ንዓበል ተወጋእ ንብል እዚ ሕዚ ንብለኩም ዘለና ኢና ኩሉ ነፃርዮ ቅድም ሽምኩም ሽም ኣቦኹም ኣድራሻኹም ዕድመኹም ምስ ረኸብና ኣብቲ ዳታቤዝ ናይ CIS ኮሎራዶ ዝብል ናይ ኮሎራዶ ሪፖርት ዝተገብረ ማለት እዩ ኣብዚ ተፈላለየ ቦታ ዝወሰድኩምዎ ቫክሲን ወይ ክትባት ዘለዎ ርኢና ካብኡ ኣውፂና ካልኣይ ዝተወጋእኹምዎ ካልኣይ ከይትውግኡ ነፃሪ ማለት እዩ ካልኣይ ዕድመኹም ድዩ ይግባእ ድዩ ሕጂ ትሓትኑ ዘለኹም ቫክሲኔሽን يقبأ ديو ويكأز يفلتكمون دحر كونكم بتعدمهم رئي إزي يليكا إزي يليكي يبل مالتي عبر سيخا انتاي سعبنا اللوو نخندي جيزة كحمم يخيل كندي جيزة خطوصدوو علىكم إلى خاطر قصاصيره بتصبق غيره تقبيله أرديه شعو تخطبوا مالتي سلازي دقخم علينا انت دليخم نابخم كنمص نخيلينا ناب ادالت كير ديو ناب تشرش ديو انت دليخم نابانا مصو كم زبولكم انا اور رئيس سرح زاغالي كان يبعل ختزاربيا علناكم نزسعبون كالي تمرت زدل اندحراليو after comment قومطلنا انديوم كمزي زامسلم صو كمزي تزخون نيرو انا حجه مولو حيلين عاخي اهيبه ناتو خلتينا قام نبلو بزبليو بتغرينيا صبق سلازي غلصكو وغن قريتا اندحاتتكو why are you doing this?
Well, I became a nurse practitioner because when I was a nurse, I was an ICU nurse, so I take care of a lot of people that are they're sick, they're already too sick, you know, they've come to the hospital, they need surgery. So when I decided to become a nurse practitioner, I chose family nurse practitioner because I wanted to work more in the prevention, right? Teaching people what they can do to prevent these illnesses before they get to the hospital. And for me, you know, I grew up in Denver, I grew up in this community, and I want to make sure, you know, when I hear about when people get sick or when things are happening, and I know a lot of people in our community, they don't trust doctors, they don't trust what they're telling them, or they're too afraid to go and get help. And so I want it to be a way for people to know that you don't have to be afraid, and you know, going to the doctor is not always where they're going to tell you something bad, you know. Sometimes going to your doctor every year is important, even for them just to tell you what you need to keep yourself healthy. Everything that in the setting that I work in the clinic, it's family practice, or when you go to your regular doctor, that's family practice. The big goal is always prevention. It's not, I know we have a lot of this notion in the community, like they want to give us medicine, they want to give us all these things that we didn't have to use back home or we didn't need before, and it's not always about that. Sometimes when you're going to your doctor, we just want to talk about how can you know, screen yourself, how can you make sure you're protected. Vaccinations are a big part of that because a lot of these vaccines are studied for a long time. They have been around for a long time and they've helped protect a lot of people. So I want to make sure in my community that we're having the same, you know, a lot of American people, it's just a part of their life to go. Their parents teach them, get this vaccine and that. And we, in our community, don't have that same thing because a lot of us didn't grow up here. Our parents didn't grow up here. They might not know what we needed. And so I want to make sure that we're having the same benefit and understanding and knowledge that everybody else around us have, so that hopefully we can keep our community healthy, keep them living longer, and keep them from having any complications.
Thank you very much. Well done. Very nice. I'm going to expect a lot more next time. So زي حجي نقبرو زلنا نايلو معنتي ناي vaccination وكان يكتباتيو نزمت زلو خاني بخمزي زامسله تماساسالي راح بتغرينيا زي كونس بانجليشون دا غبرنا نتوم زلو ابزي دقنا نحوصلو نرادادولو تمرت نوهابلو خونيو نزمت زلو دكتور كتمصنايا نساون بتناتا اكسبرتي كتገልጸልናያ ማለትዩ بصفيحو ግን ንሕዞ ዘለና እንታዩ awareness ስለዝኾነ screening أنت بيلاتو نيرا ناي breast cancer screening أدلايو ناي colon cancer screening أدلايو تقدينا إنا نخيد نحنا قبونا ويكأسر لزلينا إلنا يكوننا دحر مسحاممنا نشجر مالتيو انت أيو زلينا نعنا نزي كمينيتيزي انتاي بزحات اللو زتمهار هزبي دقنا اللو كالتونا اللو ندامس أنا كلنا خنمها حرينا نتي هيلز ملكات مالتيو ግን ካብኡ ሓሊፉውን ብሞዮኦም መጺኦም ዘምሁሩ ቁርባት ኣሕዋት ኣለውና ንኣብነት ናይ ቢዝነስ ከመይ ጌርካ ይጅመር ታክስ እንታይ እዩ 401 እንታይ እዩ ኢንቨስትመንት እንታይ እዩ ሪታየርመንት እንታይ እዩ ዝብሉ ንኸምሁሩ ናይ ዳለው ስለ ዘለው كلنا أبزي عسيلنا نتبب يبرح ون بنخيلو التبابعنا كنعبيو نخيلينا زي 24 ساعات زتحلل بميديا بتلفزيون إيست أفريقيا بمولو إيو أبزي راح يكونن نمهارو زلنا وي بيوتيوب راح يكونن نمهارو زلنا نمهار زلنا نخندي مليونات حزبي إنا نمهر زلنا كابانا حليفو كاب كولورادوون أب كالي استيتات كمزي كجمر بزخالنا يو نبركت نمهر نحجز نفلت نحتت إيه خبل زدلي بطعمي إذا مسجنكي بطعمي خبرتي هذا اللي زقالي غني اللي سنة معلتي good job good job good job
I had a really great time being here today at Tibeb Yibrah TV. It was my first time and I really enjoyed it. They made it very easy and comfortable for me and it was a really great experience. I hope that everybody will subscribe and like and watch the videos, and if anyone wants to help out, they have a really great space here, but obviously they would always take any donations, volunteer, or if you want to come help out, or if you have anything that you want to come and see or have recommendations, it is a really great space that you can come and see and spend time with the crew here.